I've been driving since we drove in the country. We lived in the country, so as long as you could touch the gas and steer, you could drive, and that was at maybe 8 or 9 or 10 or something like that. So I've been driving all that time, and all of a sudden you can't drive anymore. When the insurance company hears of dementia, first thing they do is take your license, your driver's license. That's quite a shock, so that put a lot of stress on Louise. So every place I have to go, she has to drive me, or catch the bus, but we mainly go together, but it's quite a stress.
As soon as you say that word dementia, that person has dementia, all of a sudden it's like they don't matter anymore. Everything is directed towards the caregiver. I think the fear around dementia is number one, that we are an aging population, so there is that big risk of I could be developing this. I think the more that people know about dementia, the less they would fear it.
As you go through the disease of dementia, sometimes it's very difficult because you lose who you are as a person, and you can come to the program. The staff work hard at putting people that like the same types of things, might be at the same stage of their disease process, put them together so that they can build friendships, so they can have a friendship on the level that they're at, whether it's still early stage or even advanced stage. And it's really nice to see people have the need to be friends with each other, and you can see that happening in the day program.
Well, the day program, as we know, it's intended to be a respite program for caregivers, but definitely a social program for people in the community.
We're not just a day program. We offer social work support, and we also have the nursing component, but the caregivers really, really benefit from the social work education around dementia, the disease processes, as well as those tips and tricks and caregiving strategies. We actually follow a social model. So it's more based on therapeutic recreation, social engagement, activities. We have our art therapy, an amazing art therapist who provides alternative types of programs. We have also had donations for gardening in our bird program. And that's wonderful. We get people outside, and we have some pretty hardcore gardeners and birders. And we wouldn't be able to offer all that if it wasn't for people donating to the foundation. We're extremely grateful for that.
I think our day program is very much a leader. I think we are moving towards, with research and education, I think we are moving towards the cutting edge of dementia care for clients.
Our goal in the day program is for people who have dementia to absolutely, we want them to live, but we want them to be alive. And that's fundamentally, I think, the most important thing.
You worry about them like they're your own family. Whether you're working or not working, you build this bond, and you think about work even when you're not here.
I get to come to this place every day for work, and I get to see joy. And I get to see success, and I get to see people having the time of their life, and knowing that we've actually restored some humanity for those people, for those clients, for people living with dementia. They are not their dementia. They're people, and they always will be people.